Hi, everyone. This is Pam Gibson at James Madison University, and I wanted to talk to you today about what happens when people with chemical sensitivity, what happens when they go to mental health providers. So I'm going to share my screen. I have a little PowerPoint here. Let's get it on a slideshow. Okay, so we did this study in 2016, and my students Sharon Lockaby and Jenna Bryant helped me, and it's now published in the Journal of Multidisciplinary Healthcare. So our participants were 46 women and 14 men from the US. 55 of the 60 people were physician diagnosed with MCS. We had a 45-question online survey, but they could also get a hard copy if they needed. We asked about demographics, what mental health providers they had seen and why. We asked them to describe their experience with their most recent provider. We also used the Satisfaction with Life scale by Diener et al. 1985, a short 5-item scale where each item is on a scale of 1 to 7, with 7 being the highest satisfaction. So the highest you can score on this item is 35, and the lowest you can score is 5. We placed the survey on my website at www.mcsresearch.net for 5 months and mailed paper copies to those who requested them. So of our 60 respondents, 57 were Caucasian, 54 identified as disabled, over 2/3 were not employed, most had lost or been forced out of a job due to MCS. The mean age was 52, and it ranged from 30 to 77. The mean personal income, $19,657, and the household income mean was $35,845. People rated their disability levels as mild, 10%, moderate, 19%, severe, 46.6%, or totally disabled, 24.1%. So why would people with chemical sensitivity go to mental health providers? Well, 21 people said they were simply seeking counseling like anyone else. They needed help with coping. 13 were going for disability evaluations. And you know, if you've ever applied for SSDI, that the first thing they do is make you go to a psychologist and get an evaluation. There's often a lot of pressure on the person not to be seen as psychogenic. 7 people wanted help with depression. 5 wanted medication reviews. 2 wanted validation that the condition is physical. 2 needed workers' comp evaluations. 2 needed help understanding their neurological symptoms. 1 was referred by their primary care provider for an evaluation. 1 needed help sorting out the chemical reactions from depression. 1 required an evaluation for the Center for Independent Living. So even the CILs are sending people to psychologists. 1 needed help dealing with loss, and 1 needed help for problems getting sick at work. So people had to request accommodations just to walk in the door to see the mental health providers, right? So the most commonly requested accommodations for that were a fragrance-free environment, being seen in a different location, a chemical-free room, avoiding the waiting room, and being allowed to wear a mask. 45 participants asked for accommodations, and 30 said that they were met. So what kind of accommodations were granted? Well, 9 people were granted no fragrance. 9 people were seen in a different location, including outside or a different room. 5 were seen in a chemical-free room. 4 were allowed to avoid the waiting room. 4 were allowed to wear a mask. 3 were allowed to open the window. For 3 people, they turned off the fluorescent lights and or electrical equipment, and these are the people with the electromagnetic frequency sensitivities. 2 people got no air freshener, and 2 people were granted telephone therapy. So then we asked them, how knowledgeable was your provider? And 25 people, or 41.7%, said not knowledgeable. 27 people said somewhat knowledgeable, that's 45%, and 7 said highly knowledgeable, 11%. We asked them how the experience could be better, and 10 said they could have a more educated provider. 7 said their experience was already positive. 3 said the provider could believe them. 3 said that they wish the provider would have discussed with them and helped them with life changes. 2 said that their provider should recognize MCS as a physical illness. 2 would have liked a safer office. And 2 wanted in-home help to set up family support, which is actually a great idea. So we asked, what were the worst aspects of your experience? And those seem to fall into 3 categories. 1, the exposures that occurred as a result of the meeting, such as fragrance on furniture and people, getting sick afterward, having to wear a mask. The second category was the tendency to see MCS as a psychogenic illness, receiving psychogenic labels, being given psychogenic medications, being tested for psychological problems, having to discuss what you know will be perceived as psychogenic. And third, the lack of responsiveness on part of providers, getting no accommodations. People sometimes realize that the provider just did not understand at all, just didn't get it. Having their feelings dismissed, feeling humiliated. So the life satisfaction results were quite low, a mean of 12.2 out of 35. These scores are low even in comparison with published samples of persons with other chronic illnesses. I've found this consistently over the years that life satisfaction is low on average in persons with MCS. And most probably this is related to the severe life disruption that people experience when they develop these sensitivities. So what can we get from this study? Well, psychological providers were not for the most part very knowledgeable regarding chemical sensitivities, yet their input is very important when people are in distress and in need of advocates. Yet some people experienced even more distress when seeing a mental health provider. Some were labeled, offered medications that may not be appropriate, dismissed, and ignored. Life satisfaction was poor on average and even lower than when I first studied it in the 90s, when I got a mean of 14.86 on the satisfaction with life scale as opposed to the 12.2 in this study. And in my mind, after all this time, nothing short of a complete paradigm change in regard to environmentally induced illnesses will improve this situation, which has managed to persist for as long as I've been working. I've been studying MCS for 29 years, and my students still don't know what it is until I tell them, which is really sad. It's kind of unbelievable to me, but that's where we're at. So here are my references for this one, not too many. And resources, please see my research website. You can download my book. You can read the book for free at mcsresearch.net or earthrightbooks.com. And here are my other YouTube videos on my YouTube channel. Thank you so much for watching.